Hi everyone, my name is Cassandra Tootin and I'm the Special Projects Coordinator here at the Rosalind Carter Institute in Americus, Georgia. And I'd like to welcome everyone to the Screening for Anxiety in Older Adults webinar. Before we begin, I'd like to introduce our presenter today, Jocelyn Chen. Jocelyn is the Program Director of the Fuqua Center for Late Life Depression at Emory University, Division of Geriatric Psychiatry in Atlanta, Georgia. In 2010, Jocelyn joined Emory University's Fuqua Center for Late Life Depression, a nonprofit organization dedicated to increasing access to treatment and awareness of late life mental illness in order to eliminate stigma and discrimination experienced by older adults. As Program Director, she provides support for community projects, particularly with low-income seniors. As a licensed clinical social worker, she also works in the Emory University Psychiatry Outpatient Clinic, providing education, brief counseling, and connecting patients and families with community mental health and aging resources. Since 2010, she has collaborated with the Emory Alzheimer's Disease Research Center in their support groups for persons experiencing early-stage memory loss and also their care partners. Jocelyn received her Master's in Public Health and Master's in Social Work from the University of California, Los Angeles. Both her public health and social work training have focused on gerontology and working with older adults. And so right now I'd like to pass it over to Jocelyn, who again she'll be doing the Screening for Anxiety in Older Adults, I keep wanting to say Americans, webinar. Jocelyn?
Thank you so much, Cassandra. We're talking about Americans. That's fine. We can we can call it that. As I've said previously, I'm very happy to have been invited by the Georgia Division of Aging to present in this series of webinars. I really believe that screening for common mental health conditions across the older adults and persons with disabilities that you serve is key to opening up conversations on health issues that are often missed or minimized. So I know that your staff are sometimes the only people who see the frail, isolated older people in the community, and they can be a real lifeline. So I hope this presentation helps you feel more confident and equipped to work with your clients. Usually when I speak to groups about mental health, I ask the crowd, what mental health conditions do you think are most common? And usually the crowd guesses depression. Sometimes they guess things like schizophrenia or bipolar disorder. But the answer that I get most often is depression. For some reason, nobody ever mentions anxiety. But you can see from this slide that the prevalence of mental health disorders in the general population actually show that anxiety disorders are more common than even mood disorders like depression. This data is based on the National Comorbidity Survey, which looks at a national sample of 10,000 people in the U.S. You can see from this top row that anxiety disorders are actually, people in the community actually have anxiety disorders about 19% of the time if you're looking at a one-year period. So that's almost 1 out of 5 people. And then if you're looking over the lifetime, the survey shows that 31%, or almost 1 in 3, people will experience an anxiety disorder. So why don't we think very much about anxiety? As you can see from the numbers, anxiety disorders are actually really common, but they're not very top of mind. I think that part of the issue is that anxiety is considered pretty commonplace, something that we all experience at one point or another, and that's true. There are many things in everyday life that cause us to worry: the economy, how our family members are doing, our jobs, health issues. And having some anxiety isn't necessarily a bad thing. Anxiety can motivate us to get things done, make decisions, move forward. But what we're going to talk about today is generalized anxiety disorder, which is when worry becomes excessive and it interferes with our ability to function. So the purpose of our presentation today will be to learn about generalized anxiety disorder and how to screen for it. We'll start off with some background on GAD, or GAD, and then we'll go over 2 easy-to-use screening tools called the Generalized Anxiety Disorder 2 and the Generalized Anxiety Disorder 7. These tools were actually developed by the same people that developed the Patient Health Questionnaire, which I went over in the previous webinar on depression screening. So if you've already watched that training, these tools will look really familiar. We'll go over the questions that make up the tool, how to administer them, how to score them, and some frequently asked questions. In addition to covering the GAD-2 and the GAD-7, we're going to go through the PHQ-4, which combines the screening tools for depression and anxiety, so you can screen for both quickly at the same time. The goal of this presentation is to help you feel comfortable using the GAD and the PHQ-4 to screen for anxiety and to feel more equipped towards helping your client take the first steps towards treatment. As in the other trainings, we're not trying to make you a doctor, a nurse, or a mental health expert. We're just trying to make sure you feel comfortable adding these tools to your toolbox. Now, what is anxiety? Let's take a moment to go over what this condition is. Now, because anxiety is intertwined with our everyday life, our culture, our background, it's been difficult for mental health researchers and clinicians to define exactly at what level anxiety becomes a disorder that is truly problematic. And generalized anxiety disorder usually begins in childhood, but most people don't recognize it as a problem until they're an adult. So if we're looking at the most recent Diagnostics and Statistical Manual, the DSM-5, generalized anxiety disorder is defined as having several criteria. Firstly, it has to have been going on for more days than not, so more than half the time over the course of 6 months. And the next criteria is that the person finds it difficult to control their worry. So maybe they realize that they're worrying a lot and they would like to worry less, but they're just not really able to moderate it. People with generalized anxiety disorder often worry about everyday routine life circumstances such as job responsibilities, health and finance, the health of family members, their children, or small things like household chores or being late for appointments. There are 6 other symptoms that we're also looking at. And if the person is experiencing 3 or more of these symptoms more than half the time for the past 6 months, then they meet clinical criteria for generalized anxiety disorder. So again, we're looking at these 6 things that are listed on the screen, and we're looking to see if they have had 3 or more of these problems in the last 6 months, at least for some portion of the time. And the cutoff is if they're experiencing these issues more than half the time or more, basically. So the first of these symptoms is feeling restless or feeling keyed up or on edge. And that might be sort of an internal feeling that the person can describe. Second criteria is feeling easily fatigued. Third criteria is having difficulty concentrating or feeling like their mind is going blank. And we may all kind of relate to this feeling if you're doing, if you're sitting down to take an exam, or if you're about to have a public speaking event, you might be sort of feeling like, oh man, my mind is going blank. Fourth criteria is irritability, and that has to do with sort of your mood. The fifth criteria is muscle tension. So, this isn't surprising if someone's real anxious. You might see them kind of tense up, and you can even see it in their body and kind of this shrinking sort of effect. And then the sixth criteria is sleep disturbance, and that might be difficulty falling asleep or staying asleep, or sort of having a restless sleep and unsatisfying sleep. If you've seen the depression webinar, a lot of these criteria might look familiar to you. These are actually a lot of criteria that overlap with depression. So you won't be surprised to find that depression and anxiety often go hand in hand, and we'll talk a little bit more about that later. The last 2 criteria for meeting clinical diagnosis of generalized anxiety disorder is that the symptoms have to be causing significant distress or impairment in your social, occupational, or other areas of functioning. So like many disorders, the criteria hinges on whether the symptoms are a problem for the person who's experiencing them. I think this is really important because it helps us differentiate between regular worries, maybe personalities or coping style, versus a level of anxiety that's become a problem to someone. And lastly, if you're looking at a clinical diagnosis of generalized anxiety disorder, we're going to rule out that the symptoms you're experiencing are being caused by something else, like alcohol, drugs, medication, or a medical condition. So, a question I get a lot when I present in the community is, what causes this stuff? What causes anxiety? Um, like we just mentioned, several of the symptoms for generalized anxiety disorder are similar to symptoms of depression: fatigue, feeling on edge, poor concentration, sleep problems. And that's because anxiety and depression are closely related conditions in terms of their underlying cause or their etiology. In fact, 50% of people who have a diagnosis of major depressive disorder also meet criteria for anxiety. And so some people call depression and anxiety the ugly stepsisters. They kind of come in a pair. Um, like depression, the risk factors for generalized anxiety disorder are multifactorial, meaning that there's more than one thing at play. Studies have shown that there is a pretty strong genetic component to generalized anxiety disorder. People who have family members with anxiety disorders are more likely to develop one themselves. And it's common to think of anxiety disorders as a psychological state, but anxiety disorders actually have distinct roots in our nervous system. So lastly, we know that people with certain temperaments are associated with developing generalized anxiety disorder. Why do we want to know about someone's anxiety? What effect does it have on our work? What effect does it have on the people that we serve? Research has shown that anxiety and depression are associated with diminished health status and substantially lower health-related quality of life. So anxiety is also associated with increased use of healthcare services. And there are different hypotheses as to why costs are higher. It may be that anxious people tend to seek out more services, or maybe they're less able to follow treatment plans, so their health gets worse and they need more care, and it becomes a cycle. As we mentioned earlier, we want to know about someone's anxiety so it can be part of their treatment planning. We can spend all kinds of time crafting an excellent plan that addresses someone's diabetes and high blood pressure, but if they're so anxious that they can't follow the diet or remember to take the blood pressure medication, we're going to feel like we're spinning our wheels. So we want to know about anxiety because, number one, it impacts the quality of life of the people we serve. Number two, it causes people to use more healthcare services. And number three, we really need to know about this so that we can serve them appropriately. So at this point, we're going to talk through two very brief instruments that are good for screening for generalized anxiety disorder, the GAD-2 and the GAD-7. It's important to know that even though the GAD-7 was designed to screen for generalized anxiety disorder, it's also proved to have good sensitivity and specificity for panic disorder, social anxiety disorder, and post-traumatic stress disorder. The GAD-7 was developed with primary care patients and validated with about 2,700 primary care patients. So let's clarify that neither the GAD-7 or the GAD-2 are diagnostic instruments. These are screening tools only, and they look at common anxiety symptoms over the last 2 weeks. So for people who have watched the depression webinar, that's going to sound familiar to you, right? We're looking at the time span of 2 weeks, so we should ask people to answer the questions based on their more recent history, and that gives you a clue as to whether they're experiencing anxiety disorder right now. Time is a precious commodity, and it's lucky that it takes only about 5 minutes or less to complete the GAD-2 and GAD-7. Your client can actually read the questions and mark their own answers on a piece of paper, or you can read them out loud and go over the answer options with them. So let's start with the GAD-2. GAD-2 is 2 questions, and again, you're going to preface this with your client by telling them to think about the last 2 weeks of their life, not their entire life, just the last 2 weeks, and answer how often you've been bothered by the following problems. The first question is feeling nervous, anxious, or on edge. And you're going to ask them to rate that as, have they been having this problem not at all? Have they been having it several days, more than half the days, or nearly every day? And you're going to circle their answers. In this case, this person said they're feeling nervous, anxious, or on edge more than half the days. And then you're going to ask the second question, how much have you been bothered by not feeling able to stop or control your worry? And this person answered 1. So these two criteria might look familiar to you. Those are two of the main criteria for clinical diagnosis of generalized anxiety disorder. So that makes a lot of sense. What we're going to do now is score the GAD-2, and you just add up the columns. So this first column of zeros, you don't have to add up because no matter what, zeros add up to 0. Second column of 1s, this person answered 1, 1. Third column of 2s, they had 1, 2. And the fourth column of 3s, they had no 3s. So that adds up to a score of 3. And the cutoff for the GAD-2 is that if someone scores a 3 or higher, that indicates that they need further screening. So as you can see, the score here ranges from 0 to 6, 6 being the highest. People who are scoring at the midpoint of 3 or higher, we want to give them the rest of the screening. So the rest of the screening is the 5 questions, the 5 additional questions that make up the GAD-7. So if you can see here, the GAD-2 makes up the first 2 questions, so you can just skip to question 3 and ask the next 5 questions. So the third criteria is, how much have you been bothered by worrying too much about different things? Fourth is, how much have you been bothered by having trouble relaxing? The fifth is, how much have you been bothered by feeling so restless that it's hard to sit still? The sixth is becoming easily annoyed or irritable. And then the 7th criteria is feeling afraid as if something awful might happen. So again, these are based on the clinical criteria from the Diagnostic and Statistical Manual. And this person answered these questions, and we're going to now total up the columns to find their total score. So you're going to include all of their answers from all 7 questions, not just the new 5 questions that you've answered. So again, they answered one of the zeros, but we don't need to total that up in the first column. Second column, they had 2 1s, so that comes out to 2. In the third column, they had 2 2s, so that comes out to 4. And then in the fourth column, they had 2 3s, so that adds up to 6. And when you add up all those things at the bottom there, their total score is 12. So the GAD-7 total scores range from the lowest score of 0 to the highest score of 21. Scores of 5, 10, and 15 represent cut points for mild, moderate, and severe anxiety symptoms. A score of 10 or more is the recommended cut point when screening for an anxiety disorder, and that a score of 10 or higher means that the person requires further evaluation of their anxiety symptoms. So it's fair to say that a score of 10 or higher is indicative of a probable diagnosis of generalized anxiety disorder. All right, pretty simple to use, right? It's actually the same screening criteria and scoring as the PHQ-9, so a little bit easier to remember that way. Now, I mentioned that we're going to also talk about the PHQ-4, which is the Patient Health Questionnaire 4, and the PHQ-4 is just made up of the PHQ-2 and the GAD-2. So it's an ultra-brief screening for depression and anxiety. And anxiety got kind of cut off on this slide, but this should be pretty intuitive. Nothing else has changed except that we're putting them next to each other so that within 4 questions you can screen for both depression and anxiety, which are some of the most common mental health conditions out there. So it only takes a matter of moments and you've screened for both things. Now remember that the way that we score hasn't changed, so when you've asked these 4 questions of your client, you're going to add up the first 2 questions, and if their score is 3 or greater, you're going to give them the GAD-7. And then you're going to add up the third and fourth questions, and if that score is 3 or higher, they're going to get the PHQ-9. So if someone answered these questions so that they got a score of 4 and a score of 6 for the GAD and the PHQ respectively, then they would get both of those two screening tools. And again, they're very brief and they don't take very long to finish. All of these screening tools are available online. You can see the GAD-7 at this website, PHQ Screeners, which is from the developers of the tool. And then you can also look at the link below it, SAMHSA, the Substance Abuse and Mental Health Services Association, where they also have posted this tool free and available to the public. So at this point, we're going to talk about some frequently asked questions. One thing that people sometimes ask me is, how do I know if someone's being truthful with me? You know, you're asking these kind of delicate questions around anxiety and depression. How do I know that they're answering me truthfully? And then another question I commonly get are, what are treatment options for anxiety? So let's talk through that. First question, how do I know that someone's being truthful? I imagine that people feel a little apprehensive answering questions about anxiety and depression for a variety of reasons. Perhaps they're worried that you'll think they're incapable or weak, or maybe they're afraid that you'll think they can't take care of themselves or that they're just crazy. There's actually no way we can be totally sure that someone, especially someone we just met, is being totally truthful. But I do find it helpful to take a moment to preface the screening questions by saying something like, these next few questions are about your mood because we know that that's an important part of your overall health. And I like saying mood because it's clinically accurate and non-judgmental. And if you were to say mental health or about your psychiatric symptoms or emotional symptoms, sometimes people have a lot of baggage with those terms. And they have a lot of notions of what that means. But mood is, I think, a pretty non-judgmental kind of neutral term. And you can also remind your client why you're asking these questions and how it might help in their treatment or care planning. And like in the previous webinars, you can remind them that whatever services you offer are voluntary. They don't have to do anything unless they want to. So let's talk a little bit about treatment options. Treatment options for anxiety are actually very similar to those for depression. Most commonly, treatments for anxiety and depression include talk therapy or appropriate use of medication. And here are some people who are very appropriate referrals for someone who is screening positive for anxiety. A medical doctor or a psychotherapist can do an assessment that is more detailed than the screenings that we cover today and give a clinical diagnosis of anxiety disorder. The medical doctor can prescribe medication, and often they start off with an antidepressant medication, just like the kind that's prescribed for depression. Remember how we talked about how closely related anxiety and depression are? Antidepressants often help with both depression and anxiety. There are also short-acting medications like Xanax or Ativan. Those are not what we call antidepressants, but they are sometimes prescribed for brief treatment for anxiety disorders. But healthcare providers tend to be more careful about prescribing them because they can be pretty sedating and also habit-forming. So first line of medication treatment for an anxiety or depression is most likely going to be an antidepressant medication like Prozac, Paxil, Cymbalta, some of those kinds of things. Remember that people providing screenings for anxiety and depression are not necessarily mental health experts. And if your client is feeling like they're having an emergency due to their anxiety or depression, it's okay to call 911. You can have your client go to the hospital or emergency room, or you can try to make a same-day appointment with their doctor. The Georgia Crisis and Access Line also has live mental health professionals who should be available 24 hours a day, and they can do some basic assessment over the phone, and they can even discharge a mobile crisis team to the client's home if necessary. So, you know, the previous slide was about sort of folks that you can take the next step with in terms of getting someone treatment for their anxiety. But if you come across someone who's having sort of an emergency, then here are some options. It is perfectly okay to use the options listed on this slide. Well, that actually brings me to the end of my presentation today. I hope that this was helpful in adding another tool to your toolbox in your important work with older adults and persons with disabilities. I've included my contact information here, and I really do welcome questions from the community around late life mental health. So thank you again to the Georgia Division of Aging Services and our partners at the Rosalynn Carter Institute.
Okay, thank you, Jocelyn. Um, Thank you again, like I said, for all the information that you provided with us. And I just wanted to say thank you to everyone who will be eventually watching this webinar here, and I'm sure that it'll provide them with some really valuable and important information that they can use in their future screenings. Did you have anything else you'd like to add at this point, or?
No, I think that's it. Thank you.
Alrighty. Well, if that's it, then again, just thank you to everyone who participated, and especially Jocelyn. I'm going to stop this recording at this point. And I'd like to remind everyone that there will also be a post-test that will be attached below the link that you clicked on to get to this webinar here. And we encourage everyone to take that post-test. There will also be the answers to that test for you to look at, just to provide you with some more information from this webinar. And thank you again. And at this time, we're going to stop this recording.